I kind of thought it would be botched, so I kind of wrote it in here a little bit. I would first like to acknowledge the traditional territory of the Coast Salish people where we meet today. Tabe Masi, or thank you for the opportunity to share with you my experience in healthcare. I would also like to let you know that I had technical difficulties with my pictures. I wanted to share beautiful pictures of my programming at work at my home, but instead you will see beautiful pictures of my home territory. And I'd just like to thank Dennis Cumberland for getting me out of this bind that I'm in and shared these beautiful pictures that you see today. My culture has me tell you where I come from and who I am. So I am a Dakelh woman, and Dakelh are the people that travel by water, and I belong to the Lusilyoo clan, which is the frog clan at my home. My home territory is Nakasley, otherwise known as Fort St. James in central British Columbia. Nakasley, or Etnaneyaz Gabaltizli, is the place where the little people's arrows flew out of the lake. I grew up in Nakasley, surrounded by my family. I come from the two biggest families on the reserve, so I'm related to everybody. This is where I live today, and I raise my two children. When I was a young adult, I went away to Prince George to attend the University of Northern British Columbia. It was here that I received my nursing degree. My nursing beliefs that guide my practice today come from my training at UNBC, but mostly come from my experience growing up as a Dakelh woman, living and learning my traditional values. At UNBC, I was struck by the professional versus partnership model. I am not a professional telling a person how to live their lives, but rather I am a partner helping them to find their way to a stronger and healthier life for themselves. I enhance this partnership model with my own teachings that I have learned throughout my life. We are no better or we are no less than anybody else. We need to treat others the way we want to be treated ourselves. And most importantly, we need to know who we are and we need to know where we come from. Both my life experiences and my education have taught me to treat the whole person, to look at their physical, their social, their emotional and spiritual health. I am very lucky in the fact that I get to practice nursing in my home of Nakasley. Everything that I work towards, I do for the people of Nakasley, but I also do it for my own family. I do it for myself, and I do it for our future generations. One of my hopes for healthcare is that all people are treated as people, regardless of what they look like or who they are. It should not matter a person's race, age, or gender. I want to work in an environment without jurisdictions. Today, I work in a system that is governed all the time by jurisdictions. Is this a federal issue, or is this a provincial issue? Is this person living on reserve, or is this person living off reserve? I want people to walk into our healthcare system and be looked at as a person with a story, a person not only with problems, but a person that has strengths. We need to give people a safe and nurturing service when they walk in the door. My hope for healthcare is to work myself out of a job. I want to provide people with tools. I want to provide them with knowledge so that they know what to do for themselves. I want the families to look to see and know what to do when their child has a fever. I want people to know how to prevent HIV. I want people to know how to reduce their risk for heart disease. I want people to know who to turn to when they need to get help to nurture their spirit. I want people not to live in crisis. I want people not to need me. I want people not to need our healthcare system. I want to sit at my desk with nothing to do, twiddling my thumbs. Wow, preventative healthcare, what a concept. Imagine if we invest our time and money in people, what may happen in our lifetime if we choose to work more towards preventative healthcare. I want to be able to give people tools to help themselves. Some of the tools I use get phased out. When tools work, they get rid of them. I am always referring families and community members to 811, to the HealthLinks BC website, or to the BC Health Guide. I teach, for example, parents how to treat their child with fever. I say, every baby's gonna have fever, and your baby's gonna have fever. So I teach them how to use the book. What is fever? What can you do for the fever to reduce fever? And if you see this, this, and this is when you go to see the doctor. This is an excellent tool, and last month I went to order it for a health fair, but this tool is no longer available in print. The baby's best chance. Somebody somewhere decided that they're going to take this out of a book form and put it online. But you know what? Not everybody in BC has a computer, and not every community has internet. So they started reprinting it again. And now, so we were so happy, and now there's talk that this is going to be taken away along with Toddler's First Steps, another excellent resource that I use to work with families every day. We need to remember that not everybody reads, not everybody has a computer or internet, and not everybody trusts the system. We also need to know that not everybody lives in southern BC. Please remember that there's not one thing or one way that's going to fix everything. Too many times we see a quick fix or Band-Aids that end up hurting us in the long run, especially when governments change. Problems are complex, and there's never one thing that will fix the issue, and there's never anything foolproof that will work with every person. We need to honor the person or the community that we're working with. We need to honor them by looking at what are their needs, but also what are their strengths? What combinations of strategies will work for them? This brings me to my greatest hope for healthcare. We need to stop treating healthcare as a business. And trying to save money. Yes, we need to have smart spending, but we are in the business of servicing people. Healthcare needs to go back to caring for the people. We need to look at evidence-based practice. What will work well for the people? What is shown to work for the people, not what is going to save us money. What I don't want to see is a TV commercial, sorry, Christy Clark, but I don't want to see a TV commercial of Christy Clark sitting there telling us when our kids grow up, they're going to be debt-free. They may be debt-free, but what will their quality of life be like? We need to give our kids meaningful and quality health care. Who has heard money can't buy happiness? Or you can't buy me love? We need to invest in the people, sorry. We need to care for people. We need to help them help themselves. And this is the only way to have better health outcomes in the long term across government changeovers. For the people that look at money, this will save money in the long run. I don't want this to be a big complaint, but rather a challenge to the change makers in the room. Snatch Alia, you have done me a great honor.